At the end of September, several programs funded by the United States Agency for International Development in relation to its HIV/AIDS program in Belize closed their doors. These include the Program to Strengthen Central American Response to HIV/AIDS, or PASCA in Spanish, and the Pan American Social Marketing Organization known as PASMO. At today's wrap-up ceremony in Belize City, the U.S.A.I.D. Regional Coordinator Daniel Morales told us that this is not so much a goodbye as they're stepping behind the scenes.
We are now presenting 10 years of achievements here in Belize. We are going to close our presence here with our implementing partners, but we will going to continue working with Belize in the regional board as Comisca. So it's not we just closing the field support activities here in the country, but we are going to continue working through the regional board with Belize.
So I gather you will not have a physical presence here, is what you're saying.
That's right. We are not have a physical presence, but the Minister of Health can reach us through Comisca or through the regional coordination mechanism from the Global Fund, and we can provide some specific technical assistance to the country.
Now, you said 10 years of achievements. I imagine that's a lot. Summarize for us what some of those achievements were.
Well, we have a lot of achievements, but I think we can resume one of these. The most important thing is we reach a lot of support for the key populations here in the country. We give technical assistance from the Global Fund activities here in Belize. The Global Fund grants you already receive. I know the current grant is for $1.5 million, and the other thing is we prepare the countries who have their own ownership about the work with key populations related with the HIV/AIDS epidemic here in Belize.
But with HIV being barely kept at bay, Morales says their work is not finished. The work to give people a chance to respond to the disease, he believes, will eventually turn the tide.
We are helping the country to have more effective response to that new infections. I think it's not a success to have less infection. On the contrary, sadly we have to find more infections, but I think the country is more prepared to attend that infections, to have the information for that infections, and the most important thing is the awareness of the country that the most affected population is the key population, the MSM and the female sex worker, the trans population. So I think it's not all our work is done in the country, but at least the ownership that the Minister of Health have of the problem is better than when we started 10 or more years ago. And I think it's time for us to step away and for the local presence, but we are going to continue working with the country.
The Ministry of Health will continue to lead the charge, but the rise of non-governmental organizations, most notably the United Belize Advocacy Movement, led by Caleb Orozco, ensures that for the first time, marginalized groups in Belize have a voice.
The Ministry of Health always has the burden of addressing health care for our citizens. But it is also clear that we are in a different environment where in 25 years of the epidemic, there was never an LGBT, MSM, minority group organization trying to address the health component of marginalized populations. So now we have a group that deals with sex workers, which addresses both health and violence. We have a group looking at transgender issue, which is Tia Belize. We have groups looking at young people and their health. And then you have my organization looking at policy and advocacy. So what has been created is an environment of support that will over time galvanize itself and push the issues forward. So So to me, that is a good thing, because those things would not have happened without an effort at targeting the men who have sex with men population and sex workers.
Aaron Humes reporting for News 5.